Hello, Professor Rathleff. Thank you so much for coming on the podcast today to talk a little bit more about your role at the Fourth World Congress of Sports Physical Therapy in Denmark, August 26th to the 27th. So, as we were talking before we went on the air, we were saying, man, you're wearing a bunch of hats during this Congress, one of which is part of the organizing committee. So my first question to you is, as a member of the organizing committee, what were your goals and what are you hoping to achieve with this Congress?
I think my role is primarily within the scientific committee. And one of the things we discussed very, very early on was this, when you go for a conference, you go up to a conference, you hear a bunch of interesting talks and you feel like I'm motivated, I'm listening, I'm taking in new things. But then Monday morning, when you see the next patient, it's not always that all the interesting stuff that you saw is actually applicable to my patient Monday morning. So we wanted to try and emphasize more, how can we use this conference as a way to translate science into practice? So the whole program and the presentations will be more about clinical applicability and less about more p-values and research methodology. So not that the research is not sound, but there'll be more focus on how can we actually apply it in the context that we're working. That's why also we had the main title of translating research into practice, which I think will be hopefully a cornerstone that people will see, well, if there's a really interesting talk about, it could be overuse injuries in kids, which will be a lecture that I'm having, then there'll also be a practical workshop afterwards to kind of use that, what's been presented, and then really drill down on how we can use it in clinical practice. So the goal is to get people to reflect, enjoy, network, but also take a lot of the things and think, wow, this is something that I can use next Monday for clinical practice.
And aside from a lot of lectures and talks, you've also got an informatics competition. And so could you explain that a little bit and why you decided to bring that into the Congress?
Yeah, so this was a major, not a debate, but an interesting discussion on how we can, even in the early phases of the conference, when people submit an abstract, make sure that the abstract can actually also reach more end users, target audiences for that case. So we decided that people actually had to submit an infographic together with their the abstract. So normally you send in like 250 words for a conference, but for this conference, we wanted them to submit the abstract, but also the visual infographic to go along with, and then pick, well, am I making an infographic that is tailored to patients? Is it a patient aid that I'm trying to make? Is it something that's aimed at other researchers, or is it clinicians? So they had to tick off which box am my infographic actually intended for. So when the audience or the participants come and join the conference, they can actually take these infographics. For those that want to print them, they can use in the clinic afterwards. Just another layer of trying to make some of this research more easily communicated to the audience, but also the things that can be used in clinical practice. Like some of the people that submitted abstract have some really, really nice infographics that I expect will be printed and hang on a few clinic doors around the world afterwards, I hope.
And when it comes to dissemination of research and information from the clinician to the patient or even to the wider public, where do you think clinicians and researchers get stuck? Like, where is the disconnect between that dissemination of information the information as we see, and by the time it gets to the consumer or to, let's say, a mass media outlet, it's like, what happened?
Yeah, that's a big question, because it's almost like, why are we not better at implementing new research into our clinical practice? And I think there's heaps of different barriers. We've done a couple of studies. Something new is also in the pipeline where we look specifically at the physio context, and we can see that there's barriers in terms of understanding the research. That's actually one of the major barriers, that the clinicians out there have a really hard time both finding the evidence, appraising the evidence, and also actually understanding, is this good or bad science? And then you have the whole time constraints out in clinical practice, because who's going to pay you to sit and use 2 hours on reading this paper? And remember, this is just one paper on ACL injuries, but in my clinical practice, I see a gazillion different things. So how am I going to keep up with the evidence? Is it intended that I'm reading original literature, or how am I going to keep up with it? So I think there's a lot of different barriers, but at least one of the ways I think we can overcome some of these barriers is that researchers climb out of the ivory tower and think of, is there other ways that we can communicate research, evidence synthesis? It could be infographics, it could be sort of like decision aids for clinical practice. At least that's one of the routes we're taking in terms of also the talk I'm giving at the conference, that we're trying to think of, can we somehow develop aids that will support clinical practice, something that's aimed at the physiotherapist, something that's aimed at the patient, that will sort of make it easier to deliver evidence-based practice. So we've done one tool that's being developed at the moment is called the MAP knee, which is something that can assist clinicians in the diagnosis, the communication of how do you communicate to kids about chronic knee pain? How do I make sure that they have the right expectation for what my management can be, and how can we engage in a shared decision-making process? And we have a few other things in the pipeline as well, where we want to build something practical that you can take in use in clinical practice to support you in delivering good quality care, because just publishing papers is not going to change clinical practice, I think.